Okay, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Hey, good evening. I want to welcome everyone. My name is Nathan Fletcher, and I have the great honor of being the chair of the San Diego County Board of Supervisors. And we wanted to kick off what will be a weekly public town hall, really focused around the issues of vaccine, but touching on really any issue of concern around COVID and the response and everything we're facing. For almost a year now, since we declared a public health state of emergency, we have worked tirelessly to try and provide the public information and dashboards, numbers, reports, charts, public information. But we know that there's been such a groundswell of desire to get the vaccine. It certainly offers our pathway out of this and really points us in the direction to move from response to recovery and into rebuild. That we wanted to make our top county leadership available to give you an update and then be able to answer your questions. In San Diego County, we made an early determination when it came to the vaccine. We wanted to go fast. We recognize that the quicker you get shots in arm, the more protection there is, the more lives that can be saved, and the quicker we can begin recovering. And we have done that. San Diego County is not a leader in the state of California. We are the leader in the state of California amongst counties for who has administered the most dosages per person. And that is a great testament to an incredible county team that is working tirelessly, to wonderful health system partners that have been with us every step of the way, and a testament to San Diegans who are ready to get vaccinated, who are ready to get out of this pandemic and move forward. And so we're encouraged. We know that moving fast and doing vaccines, we acknowledge and recognize means it wasn't always perfectly smooth. It was a little bumpy along the way. But again, the most important thing is getting those vaccines safely in folks' arms. And so we're encouraged by that. We have built out so much infrastructure and moved so fast, we've gone beyond the supply of vaccines. And the availability of vaccines really is entirely out of our control. The manufacturers give the feds numbers, feds give state numbers, states send them down to the counties, but we can only put in arms what we receive. As we stand before you today, our network of vaccination sites throughout the county could do about double what we have. Other counties have a problem that they need federal assets to come in to be able to administer vaccines. In San Diego County, we have more sites that are staffed and available than we have vaccines. And so we're slowed down a little bit by the availability of the vaccine. We don't think that will change in terms of significant increases in the next few weeks, but the minute that supply increases significantly, we will be ready to go to continue to administer significantly more. But in San Diego, we stood up the first vaccination superstation at Petco Park. We were pleased to welcome Governor Newsom this week to really tout the leadership of San Diego County in that site. But we didn't stop with that. We opened a second one in Chula Vista, a third one in North County, a fourth one in East County, with a fifth one coming online this week in North Coastal. And those are additive to close to a dozen community, what we call pods or points of distribution. These are smaller locations embedded in the community where folks can go to more conveniently get vaccines as well. And to date, we have administered more than 527,000 dosages, both our health partners and what we've been able to do working together. But it's not just these sites. There's programs in place for seniors called 211, help them get scheduled an appointment if they can't visit the website, vaccinationsupstationsd.com. We have dedicated sites blocked for our community healthcare workers, our promotors. If a senior doesn't have transportation, we have a program in place to give them a ride or transportation. And if they can't leave their home, then we will go to them, and we have efforts for homebound seniors that are doing that. MTS has been a great partner, offering free transit rides if you're on your way to an appointment. We're reaching out to our long-term care facilities, our Operation Collaboration, great work with CAL FIRE and our fire agencies around San Diego County have been great partners, now visiting well over 1,000 of our long-term care facilities, mobile teams that are beginning to go to senior housing complex. So we're really trying to do everything we possibly can, again, with the biggest constraint being the availability of vaccines, the supply of vaccines. And again, we hope that increases as we move forward. Initially, we started with healthcare workers. That was essential. We had tremendous strain on our healthcare system from COVID. Our healthcare workers every day out there working in our hospitals, vaccinated them. We vaccinated our firefighters because they are paramedics and EMTs. They became the vaccinators that allowed us to build out this incredible network. And then now we are vaccinating seniors 65 and older. Once we get through that and our seniors are not taking up all of our appointments, then we will move into the next tier, which is the first tier of essential workers, which includes first responders, education, childcare, and food and agriculture workers, including restaurant and farm workers. And so we don't know when we'll get there. We don't know how many vaccines we'll get. We don't know how many seniors will fill them. And then we obviously are in a wave of second appointments. So we're excited about where we're going and what we're doing, but we wanted to give you an update. I'm going to show you a few charts, and then you're going to hear from our wonderful Vice Chair of the Board of Supervisors, Supervisor Nora Vargas. And then after that, hold on one second. You will hear from Supervisor Nora Vargas, and then after that, Dr. Wilma Wooten, our incredible public health officer, will give you an update. Our head of our T3 testing, tracing, treatment, overseeing our vaccine strategy, Nick Mascione, is on hand, and we will be here to answer your questions. So let's pull up a couple things just to give you a little insight into where we are as a county, and what we are seeing. That's the Facebook page. All right, we're going to come back to the charts. Let's go to Supervisor Vargas.
Thank you, Chairman Fletcher. Chair Fletcher, it's really wonderful to be here with everyone tonight. And we know that a lot of viewers are watching us today, and I know that we've received a good amount of questions. So I do want to thank everyone who is joining us, and I want to say that it's important for us to do these types of community opportunities so that people know that the work that we're doing to ensure that vaccine distribution is being done safely, quickly, efficiently, and equitably. At the core of everything we're doing it with a health equity lens. And I think many of you know that as a county, we were able to support looking at everything that we do from a health equity lens. And we've been able to accomplish this due to the adoption of our resolution, right? And we're doing this in a collaborative fashion. Everything's data driven, and we want to make sure that it's equitable. And so due to this, we've been able to prioritize resources, and we've been able to build an infrastructure that is prioritizing our most vulnerable communities. We've listened to feedback, like Chair Fletcher said, from many community members who have shared their challenges when making appointments. We understand that it's been hard, but we've been working collectively to help eliminate these barriers, whether it's language, technology, or access to transportation. Like Chairman Fletcher mentioned, we have our community pods and our Superstations. And what's really critical about this is that these pods are in our neighborhoods, in our communities. This is where many of, we know that our communities feel safe and they're trusted locations. And so this is important because when we talk about equity, we want to make sure that we want to make sure people have places that they're familiar with, right? And so we've been able to transform some of our testing sites, like the Tubman Chavez Community Center, to also not only be able to provide the COVID test on one side, and then other days to be able to provide the vaccine, as well as our Chula Vista Center as well. So we've made sure that all of these locations are located close to public transit, because we know many people use their trolley or bus as a means of transportation, and the proximity of these spots to public transit is critical. Last week, we announced that we were launching a community health worker promotora pilot program. And the goal of the program is really for community health workers or promotores to conduct outreach to our most vulnerable populations with the goal of providing access to appointments. And we know that we heard you loud and clear. And so we have designated some community pods in South County. We're doing this as a pilot program. And as soon as it's, we know we've tried to work out all the glitches, we're going to make sure that it's expanded across the county. And so last week and early this week, different groups of promotores have been receiving the training and have started making the appointments. So we're excited about that. So we're going to continue to do everything we can to ensure we get everyone vaccinated. Lo que más me gustaría compartir con ustedes esta noche es el trabajo que estamos haciendo para garantizar que la distribución de vacunas se está realizando de manera segura, rápida, eficiente y equitativa. Al centro de todo lo que estamos haciendo está la equidad de salud. Hemos podido lograr esto gracias a la adopción el mes pasado de una resolución que garantiza que la respuesta de nuestro condado sea colaborativa, basada en datos y equitativa. Debido a esto, estamos construyendo una infraestructura que da prioridad a nuestras comunidades más vulnerables. Hemos escuchado los comentarios de muchos miembros de la comunidad que nos han compartido sus retos al hacer citas por sus vacunas. Les quiero más que nada enfatizar que estamos trabajando colectivamente para ayudar a eliminar estas barreras, ya sea el idioma o la tecnología o el transporte. Y quiero enfatizar que tenemos 4 superestaciones en el condado de San Diego, 8 centros de vacunación comunitarios. Y esto es muy importante porque cuando hablamos de equidad, nos hemos asegurado de haber identificado lugares con los que la gente está familiarizada. Entonces, eso es muy importante, ¿no? Entonces, sabemos que, por ejemplo, el Tubman Chávez Center en el sureste de San Diego, la gente lo conoce, la gente ha ido ahí a sus pruebas de COVID y ahora, pues, estamos asegurándonos que tengan acceso a las vacunas. También nos hemos asegurado de que esos centros de vacunación comunitarios están cerca de transporte público porque sabemos que muchas personas utilizan el trolley o el camión para medio de transporte. Y además hemos ampliado la capacidad del 211 para poder visitar para que las comunidades de 65 años o más puedan ayudar a hacer sus citas. Así que estamos trabajando día y noche para que reducir cualquier barrera. El programa piloto que tenemos de promotoras comunica directamente con las personas de tercera edad para apoyarlos a hacer una cita para vacunas. Esto se va a hacer ahorita en el sur de San Diego, pero vamos a hacer lo que después sea en general. Importante notar que, por último, no importa su estatus migratorio para ser elegible para la vacuna, si no tiene seguro social o número de ITIN, nomás ponga los ceros en vez del seguro social. Y la hora de su cita no necesita llevar una identificación que compruebe su edad, solamente ocupa llevar la identificación de su edad y son elegibles las personas de 65 años o más. Así que estamos interesados en contestar sus preguntas. Pueden usar la matrícula consular como identificación. Y ahora es un honor para mí presentarles a nuestra oficial de salud pública, la señora doctora Wilma Wooten. It is my honor now to introduce you to our public health officer for the county of San Diego, Dr. Wilma Wooten.
Good evening, everyone, and thank you for the opportunity to speak with you this evening. I'm just going to review a couple of slides to provide you with an update of the status of COVID-19 in San Diego County. Starting with the first slide, I want to show our epidemiology curve. And that curve, I want to bring your attention to the right of the slide. So if we go to the next slide, and if we remove the, yes, thank you. So go back to the first slide, please. All right, so the only thing that I want you to take from this particular slide is the fact that during the holiday months, this was our surge in San Diego County, where we actually saw daily cases reaching over 4,000. And at the end of November to the first few days of January, this was a surge. And in the next slide, we can now say that the numbers are decreasing. 12 out of the past 14 days have been below 1,500. And in the past 3 days, we've been below 1,000 daily cases. In the next slide, I just want to share some of the common demographics. We break all of our data down through our health equity lenses, which includes age, gender, geography, race and ethnicity, and where possible, socioeconomic status. We have 4 of those, and our data can be found on our website, www.coronavirus-sd.com. Now, for looking at the age category, 54% of cases are between the ages of 20 and 49 years of age. And the age range for all of our cases is 0 to 108 years of age. The average or medium age, rather, is 36 years of age for cases. Our gender is 51 or 52% for female and about 48% for males. And that has been stable for most, actually, of the pandemic. And recent hospitalizations, we have, and this data is as of through February 9th, we had 143 new hospitalizations and overall 11,011, which is 4.4% of the total number. And of those individuals that are hospitalized, 1,529 have been admitted to the ICU, which is 0.6% of the overall number of hospitalizations. And then lastly, we have 2,904 deaths. 51 were reported yesterday, which represents 1.2%. Going next, this slide, it shows the recent, we're back now in the blueprint for a safer economy after the regional stay-at-home order was lifted on January 25th. And these are our metrics for this week. I want to go to the next slide because the trend is what I want you to pay attention to here. And again, the peak consistent with the epi curve. But this week, our adjusted case rate is at 34. Now, the threshold for the purple tier is 7.1 per 100,000 population, and we want to be below that. We want to be 7, and that would have us back in the red tier. So this is a view of our case rates over the past few months. And finally, in the last slide, there's a lot of talk about the UK variant. And San Diego actually has a large number of these, relatively speaking, compared to the total U.S. number, which I believe is close to 600, just over 600. But our total number of cases here in San Diego is 139. And we've had 2 hospitalizations out of this total number. This is 59 more cases than were reported 2 weeks ago at our last Board of Supervisors meeting. Again, 2 hospitalizations and unfortunately 1 death. Our median age is 34, and the age range is 0 to 76, and the breakdown by gender is actually 50-50. Going to the next slide. Oh, and there have not been any of the other variants that are being reported around the nation, the South African nor the Brazilian strain. None of those have been detected in San Diego or California. So lastly, with closing all of my presentations, we want to remind the public that the 4 W's we want people to adhere to is wash your hands, watch your distance, and wear your face covering. If you are sick, develop symptoms for COVID-19, or if you don't know what the symptoms are, because the symptoms can be very similar to influenza, we want you to get tested so you will know. And then when it is your turn to be vaccinated, please get vaccinated for COVID-19. Now, please welcome our agency director, Nick Mascione.
Good evening. Our goal for vaccination is to vaccinate every San Diegan who's eligible when it's their turn. The state has established that we have to achieve 70% of our eligible population, that's 16 and older. And see, by looking at this chart, you see that about 2.7 million population is eligible. 70% of that is 1.8 million. And when we know that currently with the vaccines that we have, it's first and second dose, it's about 3.7 million doses. We already in San Diego quickly moved to starting vaccinating with healthcare professionals in mid-December. And so through mid-December through January, we did about 333,000 vaccinations. So what's then left behind to achieve that 3.7 million is about 22,881 vaccinations we have to do through June 30th to achieve that 70% of the eligible population. So, as I mentioned by the Vice Chair, we have been, with great intentionality, looking at where we put our vaccination sites. And health equity, indeed, is our driver. This chart begins to identify where what we talk about is the Healthy Places Index, where the virus has hit hardest in our communities. So we align, as we've done with T3, our testing sites, we're following the same approach with our vaccination sites. And this slide is a depiction of a host of county and partner superstation sites. All those are active, including 2 that you'll see that are pending, that are going to be opening up literally this week. In the next slide, it depicts what the actuals are today. So we have 8 county-hosted sites, 4 superstations that are doing upwards of about 5,000 potentially if there's vaccine. Hospital, county partnership sites. We have something in collaboration, operation collaboration with CAL FIRE, County Fire, working with city fire departments, where the paramedics and their EMTs are going into more of the long-term care facilities and doing various vaccination events in their respective cities, including the backcountry area of our county. And then we have a whole bunch of other mobile teams. Well, with all this might, based on what vaccine we have currently, we've been averaging 12,000 vaccinations per day. But if you look at the next column, based on what the chair talked about, Chair Fletcher, the capability of what we built, the infrastructure, we could have done 21,000 vaccinations per day. Now that gets back to what that goal was, that 22,800 goal. And so by the end of this month, we will have built the capability to do 35,000 vaccinations per day by the expansion of county-hosted sites, superstations, more hospital partnership sites, operation collaboration, and again, always with the lens of going into communities that need it most. Next slide. So, as it's been mentioned, we're currently doing our elderly, 65 and older, and on our healthcare personnel. The very next group is our emergency services, our law enforcement officials, also our education and childcare, as well as food and agriculture and field workers. These are the groups that we have now preparing for, that as soon as it is the appropriate point of the health officer announces we move to those groups, we immediately begin the vaccination with all of these groups next. Next slide. And so looking ahead, clearly vaccine. So we are at the mercy of what we receive through our chair and our board advocating strongly for more vaccines and showing that in San Diego, if they give us more vaccine, we can get it into arms and protecting San Diegans. But that continues to be a rate limiting factor for us. Workforce, we're building up our vaccinators. We started early with vaccinating the vaccinators, making sure we're building the workforce. Our hospitals and clinics have really stepped up to the plate. We enlist the support of volunteers and just building the infrastructure to maintain all those sites. Locations, as I mentioned, matters immensely. Looking at different types, drive-throughs, walk-throughs, all the different type of locations, mobile teams, making sure that as we think about the needs of our county, we have ways of getting vaccines to the entire community. Information technology and data is another one. Working with the new system of the state called My Turn, and knowing that there's some frustrations with making appointments, streamlining that, making it easier for folks. And we were one of the first 2 counties, us and LA, to be the pilot for My Turn. And I think that's a distinction of looking to San Diego and paving the way, and then turning, of course, that around to helping our residents, making it easier. And for those that then are not able, it's working with 211 San Diego, where folks who don't have the ability, that are currently 65 and older, can call 211 and they literally assist them and help them make an appointment. the data becomes extremely important as we looked, as Dr. Wooten talked about, in guiding our work and where we are being driven to where the needs are, vaccinations, and lastly, community engagement. And as the Vice Chair talked about, how do we engage with the community, deal with vaccine hesitancy, deal with the outreach and helping people get linked to appointments to get their vaccinations. And with that, I'll turn it back to Chair Fletcher.
Thank you, Nick. Thank you, Dr. Wooten, and thank you, Supervisor Vargas, for all of those great updates. At this point, we're going to go to questions. We're taking them in from a variety. Some were sent in, some have been posted on Facebook or on other social media outlets, and so we'll hear the question, and then whoever is most appropriate will respond. So let's go to our first question.
Okay, so these are questions that were pre-submitted by folks via a form. The question number one is, can you provide an estimated time frame for when you plan, expect, hope to begin vaccinating the next tier of ages 50 to 64?
Yeah, it's really hard to make predictions about when we can move because we don't know the supply, or you don't have great insight into how many vaccines will be coming or when the demand is. And we've always, throughout the duration of COVID, been really candid about what we know and what we don't know. And so again, we're really dependent upon the supply that's entirely outside of our control. Right now, we're doing seniors 65 and older. The next group that it will open up to will be that first group of essential workers, first responders, law enforcement, childcare and education, food and agriculture. And then when we get through those, we will go to the next one. But it's also important to keep in mind, we have to administer the second dosages for everyone who got a first dose. So we're not sure. We really hope the supply increases quickly. And we know people are eager to get it. And we're eager for everyone to get it. And we just ask for everyone's patience as we work through this.
Okay, second question is, why did you all vote against cops getting the vaccine? Jack from San Diego.
Yeah, look, we get everyone wants it and everyone wants the vaccine now. And I get that. I do. I understand it. It's potentially life-saving. And folks have had a difficult year. But from the very beginning, the very first systems that were outlined always had law enforcement in that first group of essential workers. That's where they were months and months and months and months ago in the CDC guidelines. That's where they are today. So no one on the Board of Supervisors voted against anyone getting a vaccine. There was a desire to say, law enforcement said, we want it right now. And I get that people want it right now, but right now we're doing seniors. And seniors represent 90% of our death. And I do not believe, and the majority of the Board of Supervisors did not believe it was appropriate to take a vaccine away from a senior and give it to a younger, healthier workforce. Because for that senior, COVID can be a death sentence. And so I know law enforcement wants it right now, and teachers want it right now, and a lot of folks want it right now. But at the end of the day, if we can save those lives and we can get those seniors vaccinated, then we can move into the tiers of essential workers. And again, this has been the plan from day one. No one should really be surprised about the order at which we're going. But I know it's a difficult time and contentious time, and folks kind of like to stoke that and do that. But we're moving forward with the plan we have. Once we get through seniors, then we'll get into that first tier of essential workers, which includes law enforcement.
Okay, the next question is from Kathleen Freer. I'm concerned there's no special attention to ensure low-income residents receive vaccines. Are there mobile units? And if there are some starting, are more planned?
Yeah, I think y'all touch on that, and then we'll have Supervisor Vargas, who's worked really hard on the equity issues around this, touch on this. When you look at the map that Nick shared with you for where they're placed, they are placed in the communities that have been most impacted by COVID. It is an overlay of the California Healthy Equity Index and the case rates. We've tried to make them most convenient. We also have blocks of appointments that are dedicated for those communities. Community healthcare workers are working to fill those. And so everything we've done really has been driven by a lens of equity and reaching communities. And we recognize there's issues of digital divide. Not every senior has a computer and the ability to get through, which is why we stood up phone lines. We have transportation programs for people who don't have a car or vehicle. We have mobile teams that are out in hard to reach communities. Those are all going places. And so We're going to continue to do everything we can to make sure the vaccine is not only free and convenient, but accessible, especially to communities that might have less access. But love to have Supervisor Vargas touch on this because she's been working very hard on these issues as well.
Thank you, Chair Fletcher. I think what I would add to that, in addition to all those comments, is that the reality is that there's a lot of misinformation about the vaccine, and so what we're trying to do is make sure that we have trusted messengers that are getting out there to our low-income communities, and also working closely with employees so that people are able to get out and get their vaccines when it's their turn to be able to get the vaccine. And so we have been doing, particularly in South County and some of the most communities of need, we're really focusing on making sure that folks have access to information in language, that we are working with our trusted community partners, and we actually have invested resources in partnership with our community partners so that they are able to share the information. And so what's great about this is that the infrastructure was built as we were trying to make sure that we had enough testing sites for COVID testing, and I think we learned a lot from that, and the county team has really been exceptional about hearing back from the community and changing things around. But we want to make sure that people know that the vaccine is safe, that the pods are in their communities so that they're able to have access. And if you think about the fact that you have about 6 pods in the South Bay alone, where the highest concentration of communities that have been impacted are concentrated, I think that we're moving forward to make sure that people have that access. And I think the other piece of it is that we welcome any feedback and recommendations as we're trying to make this accessible and that people get their vaccines.
Thank you. Let's go to our next question.
Okay, next question. When are people who work with children, like childcare workers, teachers, after-school program leaders, going to be allowed to get the vaccine? And that was submitted by multiple people.
Yeah, all of our education and childcare are in that first group of essential workers that come next after seniors. So we started with healthcare workers when we had slack in the system, meaning all the appointments weren't filled. We went to 75 and older. When we had slack in the system and all the appointments weren't filled, we went to 65 and older. And then when we have slack in the system now and seniors are not using them, then we will again open that next tier. The real limiting factor is just supply. If we get more vaccines and we get through this earlier, and we're able to move to that next phase and tier. So we just ask folks to remain patient. We're doing everything we can to get them in arms as quickly as possible, and we can't wait to get to everyone in San Diego County.
Okay, the next question from Germania Velez. Are non-California residents able to get the vaccine here in San Diego? What about people who are undocumented?
Yeah, so our vaccine allocation here is for people who live in San Diego County. And so you have to be able to show that you live or work in our county. But beyond that, there are no other criteria or qualifications. If you live or work here, you are eligible to get it. And I'll let Supervisor Vargas also add on to this question a little bit.
Yeah, I think it's really important for anyone. It doesn't matter what your status is, and or if you live in a mixed status household. It's important to recognize that first, number one, that the My Turn website now is also in Spanish. It was launched this past week, and so that's really important. We heard loud and clear at the vaccination centers that people were having trouble in terms of being able to share their identification, and so people are able to bring their matrícula consular as their identification so that they can prove their age and what level they're in terms of the phases. And then also, they're able now to fill out the information and come to any of the centers to be able to get their vaccinations. And so I think what we want to make sure we emphasize is that the information that's captured, it's confidential and it's not shared with anyone. And if it's okay with you, I'll just say it really quickly in Spanish to emphasize it to folks that cualquier persona, no importa su estatus migratorio, tiene el acceso a la vacuna, y lo único que tienen que hacer es llevar su matrícula consular, su identificación, y que por favor sepan pues que la información es confidencial. And so just wanted to reiterate that the information is confidential and it's not being shared with any of the authorities, because I know that people were concerned about that. So it's important to emphasize that.
Great. Let's go to our next question.
Okay, the next question comes from Patrick Sullivan. What are the recommendations for people who have received their second vaccine in terms of mask wearing and other protective measures after having that second shot?
Let's have Dr. Wooten walk through the medical guidance on that.
So thank you for that question. So you saw the goal for the nation, 70% of individuals being vaccinated, and that is to try to achieve at least the beginning of herd immunity. You may have heard Dr. Fauci say that that number even needs to be higher. But until we have the collective impact of vaccinating at least 70% of our population, the recommendation to continue the same preventive strategies that have been advised since the beginning of the pandemic continue. Wash your hands, watch your distance, and wear your facial coverings. That's very important.
Thank you, Dr. Wooten. Let's go to our next question.
Our next question comes from Sylvia Cunningham. Now that there's people over 65 getting vaccinated, what changes on what they should and shouldn't do are coming? Can their grandchildren and children visit indoors? Can they get together with other elderly vaccinated seniors? We need some recommendations on what is safe.
Let's go back to Dr. Wooten for that one.
Actually, the response is the same as the last question. Until we have herd immunity in our community, and even beyond our community, but in the nation, because as people come and go into our county, they could potentially increase the risk of exposure if they're bringing it from other locations. So family members live in other locations. If they come here, visit their elderly population. So we are still encouraging everyone to wear your facial coverings, watch your social distancing, and adhere to those hygiene practices. If you are not living in the same household, if you're in the same household, continue to do what you're doing. You don't have to do those things. But when you go out into the community or interact with other groups or other families, we want you to continue to practice those strategies.
Thank you, Dr. Wooten. Let's go to our next question.
Next question comes from Margarita Holguin. We're hearing that vaccine sites have leftover vaccines at the end of the day and that those vaccines have to be used. However, when I've gone to the Chula Vista site, I have been told no vaccines are left. So is it true? Are there leftover vaccines?
So each of our sites really takes great effort to ensure proper dose utilization, meaning they plan out the appointments and the dosages so that they arrive at the end of the day with hardly any left over. And if they do, it is just a very small handful. And so in that situation, each of the sites has a protocol they follow to make sure that people who are in the right tier are eligible to get those handful of ones left. But we haven't had the problems you've seen around the country of wasted vaccines or not used vaccines. That really hasn't been an issue here. If you have a good appointment system, good reservation system, good dosage utilization, they don't really run into that. And so we ask people not to go and just try and show up. That's why we have an appointment system and people to not fear that some of the stories you may see around the country of wasted vaccines has not been an issue or a problem here in San Diego County.
Our next question came in Spanish. I will introduce it to, translate it to English as well. ¿Qué está haciendo el condado para evitar turismo que viene a ponerse vacunas de otros países, quitándole vacunas a residentes de la región? What is the county doing to prevent tourists from coming to our region to get vaccinated and taking supply from our local residents? This is from Wolf Bielas.
Have Supervisor Vargas tackle that one.
Ok, es importante que las personas sepan que pues en realidad tienes que ser residente de Estados Unidos, de San Diego en particular, para que te puedan dar tu vacuna. Entonces tienes que comprobarlo, ¿no? Hemos oído de casos donde ha habido personas pues que abusan del sistema y pues que usan el turismo, pero eso no es algo que estamos nosotros abogando para que suceda. En realidad lo que estamos haciendo nosotros es enfatizar que las comunidades de aquí de San Diego, pues tengan acceso. Así que vamos a seguir haciendo todo lo posible para que las personas que viven aquí en San Diego tengan la vacuna, pero no hay ningún programa de turismo, ni mucho menos. And so what I mentioned was that, you know, we know that there have been some folks, we have heard some stories in other areas where people have, you know, taken advantage and have gone through the process. But what we want to emphasize is we want to make sure that all San Diego residents, no matter what their immigration status is, that they are having access to their vaccines. And so we're going to continue to do that and make that available. But there is no tourism program for people to come and get vaccines in San Diego.
Thank you, Supervisor Vargas. Let's go to our next question.
Okay, next question. This one was asked by multiple people. Why are vaccine superstations empty? Case in point, Chula Vista location on February 9th.
Yeah, again, we have limited supply, and it's been a little bit of an erratic and inconsistent supply. And so one thing we don't want to do is schedule appointments if we don't know that we have the vaccines. And so, you know, as we started with one superstation, then we had enough vaccines for that. And given we're now at 4 and about to be 5, plus all of the other sites, they're being spread out a little bit. And so each of our sites is running under capacity. We could be doing more if we had more. And so at times, they may hold back those appointments until the vaccines actually arrive. You know, it's a balance of pushing as hard as you can, but also, again, not scheduling appointments for a vaccine that may not be there. And so there have been some fluctuations, but we continue to have great demand on the appointments that are out there and a great need for them. And so, you know, we continue to work and try and fill them as quickly as can. But there are going to be some day-to-day fluctuations, primarily based on the availability of vaccines. And I don't know, Supervisor Vargas, I don't know if you want to add anything on that, since Chula Vista's in your district. You were so involved in getting that stood up.
Yeah, you know, I think I want to emphasize that what we've been doing is really trying to make sure that as many people get their access to their vaccines. And I think, you know, we had this conversation with the governor this week that we want to make sure we had enough vaccines to get everyone in our communities vaccinated. But at this point, then, you know, I'll just call it out. I think somebody sent out a picture of you know, some seats that were empty, and just to highlight that it was partly because at that time there was only certain folks that were getting vaccinated, and that's why, you know, it looked like there wasn't enough people there. But we are doing everything that we can, and we're making sure that people get their appointments and they come. It's all we can continue to do. But there are no, I think, emphasizing that no vaccines are being thrown away, and that as soon as we know about appointments, we're getting people the information out there, and they're filling them out as soon as possible as well.
Thank you. All right, let's go to our last question for tonight.
Okay, last question. What is the county doing to help people get their second dose appointment? I still haven't been able to get mine. That's for multiple people.
Yeah, the second doses are generally handled. It depends on where you get the first one. So My Turn, if you go through one of those sites, that helps schedule your second. If you go to one of the superstations that were one of the early ones to set up, then they will contact you at that period of time, about a week before you need your second dose. Obviously, one of the vaccines, you know, there are different days, 21 or 28 days after, but they will reach out and contact you or give you information when you get your vaccine for how to schedule your second one. It is important to note that right now we honor second dose appointments first, meaning as we get new vaccines in, they go to second dose appointments, and then whatever we have beyond second dose appointments, we open those up to new first dose appointments. And so the number of first dose appointments we've been able to do over the last 6 weeks or so may not be as great in the coming weeks, because we're going to be going through a round of getting those second doses in, but hopefully the supply will increase as well. So we just encourage everyone out there, again, stay patient. We know folks want it right away. We appreciate that. We're doing everything we can to get the vaccines out there. And then, you know, we also just want to remind everyone, COVID's still here. Our case counts are definitely trending in the positive direction. We're headed in the right way, but we don't want to lose our guard. We don't want to see a spike. We've got more contagious variants that are out there. So everything we did to take our cases from 4,000 a day to now under 1,000 a day, we want to keep doing, because as that case count comes down, as more people get vaccinated, we'll descend in the tiers. We'll be able to open up more things. We'll be able to save more lives, get more businesses going, get our kids playing more sports, and really move forward in a positive direction. So we just encourage everyone out there, again, please continue to be patient. We're doing everything we can to get vaccines out as quickly as possible. Please please continue to wear your mask and physically distance and avoid those high risk settings. There is a light on the horizon. We feel like we're headed in the right direction, but we still got a little bit of work left to do as a community. So thank you all very, very much for joining us. We'll be back every week doing these, taking your questions, giving you updates. Before we leave, I'd like to go to Dr. Wooten and then Supervisor Vargas to see if they have any closing thoughts for us tonight. But thank you all very, very much for joining us. Dr. Wooten?
Thank you, Chair Fletcher. I just wanted to provide you with an update. During my presentation and on the CDC website, no South African or Brazilian variants in California, but just this afternoon, hot off the press, there's been one case reported of the South African variant in Alameda and one in Santa Clara, so 2 in the state of California as of today. But if you go to the CDC's website, it will show 0. So just want to encourage people that the best way to decrease the spread of these new variants is to follow those 3 practices, or 3 W's: wash your hands, watch your distance, and wear your mask. Thank you.
Thank you, Dr. Wooten. Supervisor Vargas, you want to close us out?
Sure. Thank you, Chair. I really just want to say thank you to everyone that was able to join us, everyone that was able to share, ask all their questions. Thank you to Nick and Dr. Wooten for all the great work on their team as well, and everyone else. And last but not least, muchísimas gracias a todos los que nos acompañaron. Vamos a hacer todo lo posible porque esta información esté accesible para todos ustedes en otros idiomas, al igual que el inglés y en el español. Así que no dejen de usar su cubreboca, estar de distancia con las personas, y muchísimas gracias, y nos vemos cada semana a esta hora, a las 6 de la tarde, para darles más información. So we'll see you next week on 6 o'clock, same time. Thank you.
Thanks, everyone. Have a good night.